Hello, hello. This is Stephanie with Telehealth Talent, here to bring you another video about who's hiring in the healthcare field. Now, this position is the healthcare support rep. It's an independent contractor position. It is 100% remote. It's US based. So if you live outside of the US, you probably won't qualify for this one. This is US based. Again, it is the healthcare support rep. It's an independent contractor position with LiveOps. So let's go over it. Let's get into it. So make a difference one call at a time with the freedom to serve on your terms. So it says join a vibrant network of self-employed professionals making a meaningful impact every day in the healthcare industry. Whether you're supporting patients or providers, your compassion and expertise help people get the care and answers they need, all while you enjoy the freedom and flexibility you've always wanted. So again, this is an independent contractor position. So as an independent contractor, if you're not familiar with being one, you will be your own boss. You will choose when and whom you provide your support services. You can set your own schedule. You also can provide a distraction-free home office. So you have to have a home office, home-based office. It has to be distraction-free, free of noise. So distraction-free, free of noise and distractions. You also have to provide your own office equipment, handle customer calls, assess needs, and solve problems. The requirements: you have to have at least 1 year of phone-based healthcare patient or provider support experience. Computer skills, including navigating multiple systems and documenting call notes. Strong communication skills and the ability to connect with diverse individuals. Ability to sit for long periods. Patience and empathy. Ability to provide services pursuant to your contract independently. Independently. Apparently I can't read today. Contract independently. Okay. So some of the preferred qualifications, let's go over those. You have to have experience in healthcare or related fields such as medical, social services, education, mental health services, or relevant people helping fields. In-depth knowledge of health insurance, including specific programs such as Medicaid and Medicare. That is highly desired because a lot of people have Medicaid and Medicare. Okay, comfortable with medical and health insurance terminology. And they ask you to refrain from offering medical advice. No diagnosing. No saying, I think you have this. Just go with the flow. Compensation. Let's talk about that. Submit invoices and receive payment for completed services pursuant to contract. So make sure you read over that independent contract, the contractor agreement, so that you will see what the company is going to pay you. Pay structures vary based on client program, and most programs pay for productive time. May include performance-based pay. Independent contractors are responsible for their own taxes and expenses. So at the end of the year, when it's time to be issued your tax form, you will get a 1099. You won't get a W-2, you'll get a 1099 because that is what independent contractors receive to pay their taxes. You'll still be able to do your taxes the same way. If you're not familiar with being an independent contractor, make sure you do your research. Make sure you research an independent contractor. The pros and cons between independent contractor status and being a regular employee, a regular W-2 employee. And put in the comments if you have been an independent contractor before. What do you prefer? Do you prefer being an independent contractor, or do you prefer being a regular W-2 employee? I prefer being an independent contractor. I've been an independent contractor within the healthcare field for a long time. I have been a W-2 employee. I've even been a W-2 employee recently. But being an independent contractor, you can still do both jobs if you want to. So you can work as a W-2 employee and still work as an independent contractor for other companies. So if you're not familiar with being an independent contractor, please do your research and see if that is a good fit for you. A lot of people don't understand independent contractor status. So make sure you do your research. Okay, so to become an independent contractor with LiveOps, you are required to complete an application and pass a background check. You have to sign that contractor agreement. You have to complete a W-9 and set up direct deposit. You also have to complete program-specific certifications. So the background check is $25. It's just for this. Not all independent contractor positions, not all of them you have to pay. I've never actually paid for a background check, but I've also never worked for LiveOps. So I have heard that they do charge $25 for their background checks, and that is just to pay the background check vendor. They use a third party vendor, so they have to be paid. So that is their fee, $25. So some of the computer requirements, some of those are, some clients may require additional security measures and equipment, wired internet connection. So you have to have that. You can have an Android or an Apple phone. Provide your own equipment. So you do have to provide your own equipment. You have to have a Windows operating PC. So unfortunately, Macs, Chromebooks, and tablets are not supported. So you can't use that. Now, some remote positions, you probably could use it, but it'll be specific to letting you know if you can or can't use those. Okay, but in this position, you cannot use that. You have to have a Windows operating PC. Hours, choose your own schedule by self-scheduling 30-minute blocks. Client hours of operation will vary. Let's go over the important notes. Additional checks regarding OIG and SAM. Exclusions list. Those exclusions lists may be required by clients, okay? Some clients and programs may have additional requirements and certifications. So some of the companies that LiveOps hires for, they may require, they may have additional requirements and certifications. So look out for those. Make sure you do your own research, as I stated before. That way you'll know which companies have additional requirements and certifications. Okay, you're gonna also have to ensure the clients you choose align with your availability and commitments. So make sure that whoever you choose, you're able to work for them. Okay, apply now and become part of the LiveOps Nation, where flexibility meets opportunity. All right, so we're going to do a recap. Let's go over it again. A couple of specifics. This is the healthcare support rep. It's an independent contractor position. It is 100% remote and it's US based. So, as an independent contractor, as stated before, you'll be your own boss. Okay, you can choose when and whom to provide support. You can set your own schedule. You have to make sure you have a distraction-free home office. Provide your own home office equipment, handle customer calls, assess needs, and solve problems. 1 year of phone-based healthcare support experience. Computer skills, including navigating multiple systems. Okay, you have to have that. And you also have to have experience documenting. Okay, you have to be able to document everything that is said on the phone call. Remember, in healthcare, if it's not documented, it did not happen. Okay, that is what's taught in healthcare. If you don't document it, it didn't happen. And I always tell people to CYA. Make sure you document. Cover your blank. You know what the A is. So, if you don't document it, it did not happen. Strong communication skills. The ability to connect with diverse individuals. Ability to sit for long periods. Patience and empathy. Ability to provide services. Okay, you have to make sure that whatever is in your contract, it gets done. It's basically what this says. Preferred qualifications, experience in healthcare or related fields, in-depth knowledge of healthcare insurance, especially Medicaid and Medicare. Comfortable with medical and health insurance terminology. And please, please, please do not offer medical advice, is what they're saying. Compensation, submit your invoice so that you can get paid. If you don't submit an invoice, you don't get paid. Pay structures vary based on client programs. Independent contractors are responsible for getting their own taxes done, okay? Their own taxes and expenses. Okay? So if you spend extra, if you have to buy a new computer for your job, you can take it off your taxes. That's what expenses are. Okay? Of course, you're doing your taxes just like you would as a W-2 employee, but the difference is you can get money back within reason for your extra expenses. Okay? You have to talk to a tax professional and they will let you know what those extra expenses, what you can get good money back from. So let's go over to become an independent contractor. You are required to complete the application and the background check. You have to pass it. Sign an independent contractor agreement. Complete the W-9 and set up your direct deposit. Complete your program specific certifications. There is a background check. As stated before, it is $25. It is non-refundable. It's non-refundable. Computer requirements. Some clients may require additional security measures and equipment. Wired internet connection. You have to have that one. Android or Apple phone. Provide your own equipment. You have to have a Windows operating PC. Unfortunately, Macs, Chromebooks, and tablets are not supported. Unfortunately. Let's talk about the hours again. Choose your own schedule. You self-schedule 30-minute blocks. Client hours of operation may vary. Here's some important notes, additional checks. Okay. additional checks regarding these programs. Okay. The exclusions list may be required by clients. Some clients and programs may have additional requirements and certifications, and ensure the client you choose aligns with your schedule. Okay. Aligns when you are available and committed to do work for them. Okay. Those are some of the things, okay, that we will be that you can look over. Okay. Again, this is the healthcare support rep independent contractor position. It's remote, US based. And like I said before, if you've been an independent contractor before, put in the comments whether you prefer being an independent contractor or a regular W-2 employee. Let me know, let me know which one you prefer if you've ever done it before. But make sure you do your own research. If you're not familiar with being an independent contractor, make sure you do your research about what, the different things about being an independent contractor, just to make sure that you are a good fit. You may read over it and may not want to do it. You may want to be a W-2 employee. Nothing wrong with it. You still make money. You're still going to make your money. I myself prefer independent contractor, but that's just me. I've been a W-2 employee before. Nothing wrong with it again. Again, this is Stephanie with Telehealth Talent. Thank you for listening. I wish you well on your job hunting journey. Don't forget to like, subscribe, and follow this page for more remote, travel, and in-person positions in the healthcare field. And I will see you next time, guys.